I'm Dr. Shawn Tassone. Welcome to Confessions of a Male Gynecologist, a podcast dedicated to women's health and hormones, and pretty much everything else you were never listened to when you went to the doctor's office. I'm board certified in OBGYN and integrative medicine, and I have a PhD in mind-body medicine. I guess you could say I'm a little bit outside of the box. In this podcast, I'm going to get you the answers you probably asked 5 other doctors and were kind of blown off. I want you to know that I'm not only here to talk, I'm here to listen as well. And now, let's get to those confessions. Hey everybody, it's Dr. Shawn Tassone here, your trusted holistic health advisor and America's holistic gynecologist. I want to introduce you to a remarkable product that I've talked about a lot lately. It was actually my number one product of 2024 from a family-owned, American-made supplement company that's been dedicated to quality since 1978, Endurance Products. And you can explore their offerings at their website, Endur, ENDUR.com. The supplement that I'm just super excited about is called dihydroberberine SR 150 milligrams. It's a sustained release formula called Glucovantage, which is the dihydroberberine itself. It's highly bioavailable and outperforms standard berberine at much lower doses. Most berberine is 600 milligrams. This is 150. Once it's absorbed, dihydroberberine really and quickly turns into berberine, helping to support healthy blood sugar levels, heart health, and how the body uses fats for energy. What sets this particular product apart is the fact that it's sustained release, which ensures a steady release over 5 to 7 hours, and it digests the way your body naturally processes food. Plus, it eliminates the digestive upset that can occur with regular berberine. As a special offer for my audience and my audience alone, Endurance Products Company is providing a 10% discount on your order. All you got to use is Dr. T10, so DRT10 at checkout when you visit their website, Endur.com. After 25 years of practicing medicine, I'm going to be the first one to tell you that not all supplements are created equal. You know this. I talk about it all the time. But when I discovered dihydroberberine SR, I was given the opportunity to see something genuine. And I'm going to tell you what, I am also genuinely impressed. Not only is the science solid, but I love the fact that it's family made, it's made in America, and the company cares about doing what's right. I've started recommending it to my patients. I take it myself, and the results also speak for themselves. So take a look, dihydroberberine SR 150 milligrams from Endurance Products. Stay healthy and empowered. Hey, everybody. Welcome to a new episode, something that we've been thinking about doing for a while. And now that we have this nice setup, we're going to do segments as often as I can, hopefully once a week, called Shit Shawn Says. And the premise is those of you that actually don't mind my sense of humor and the way that I'm sort of blunt, like the fact that I'm a little bit kind of offbeat. And so I wanted Maddie to just bring me questions, public relations, kind of, current events, things like that, and not have any prep and just answer off the cuff. So it might contain a little bit of language. I'm just not going to hold anything back. I'm trying to be nice on Instagram at this point, but I'm just going to answer these however I want. So Maddie's just going to start asking questions and I'm just going to answer them.
All right. So I have been finding some articles. If the audience has anything that they want to submit, then obviously we'll be happy to include those in future episodes. Anything pertaining to women's health or just some health stuff in general. To start, I wanted to get your opinion. There was, let me see where this article was actually, through the State University of New York, that there's now an over-the-counter birth control pill. You've discussed things like women being responsible for birth control and kind of obviously what the birth control pill does to women's hormones. So what are your thoughts on something like that?
Well, to preface it, when I say birth control is a woman's responsibility, what I think you meant to say was that I think it shouldn't be a woman's responsibility, but unfortunately it is, because the only thing guys can do right now are condoms. And then when they want to do a vasectomy, they're chicken shit and they don't want to do it because they think that their weenie is going to be affected in some odd way. But I'm kind of torn on the whole birth control thing because I think that it gives women better access. Current birth control that's over the counter is a progesterone only pill. So the side effects are pretty low. I think it makes it more open to women. There's maybe a little bit less of a stigma attached to it if they can just get it at Walgreens or CVS. But the problem that I have with it is that what people tend to do, and this isn't women, this is guys too, is when you give them something like that, like let's say Motrin, and they have a pain, they'll keep taking it, and they won't call for help, or they won't say, oh, this is weird. And then they'll just start self-medicating. So I could foresee a woman having like a weird period or pain or something. Then she just starts taking 2 of them a day and just starts over medicating herself. So I hope that that doesn't happen. I'm all about the access, but I'm worried about the self-medication piece.
On top of that would be there is also the option of doing a birth control patch, which they would change weekly. I haven't actually heard of that. So what are kind of the pros and cons to something like doing a patch for birth control?
I haven't used a birth control patch probably in 20 plus years. And the reason that I stopped using them in the first place was a lot of women were having horrible acne outbreaks with them. I don't know why, but it was like rampant. I think the dosages, at least back then, were way too high. I was getting a lot of cramping, a lot of bleeding, a lot of acne. And so I just went away from the patch. I liked the idea of it in the beginning. But again, you're dealing with hormones that are not bioidentical. They're synthetic. You've got a synthetic estrogen, you got a synthetic progesterone, and it's usually, in my opinion, the synthetic progesterone that causes the problems. But again, I just would worry that if it was over the counter and probably would even have more complications than the pill, because this also has estrogen in it, that I just think, again, are you going to put 2 patches on? Because there's always going to be that person who thinks, oh, I really don't want to get pregnant. I'm going to put 2 patches on that fucking have them on their head and their kneecaps and whatever. Or, hey, what if I had this happen when I was younger? I think I had to come home from spring break for college. And I went downstairs and I was in the kitchen and I heard my stepdad upstairs like screaming like, oh my God, oh my God. So I go running upstairs. My mom had left the house and he was in the shower. So nobody wants to see their stepdad naked. But anyways, I thought he was hurt or something. So I opened the door and I'm like, what's wrong? And he's like, I've got your mom's estrogen patch stuck to my leg. And so he's freaking out. He's like, am I going to grow boobs? And I'm like, oh my God, that is not how it works. But yeah, so what if you're in bed and you're having sex and it falls off and you don't know, or sticks to your partner? So there's just all those little weird things like that.
Well, a lot of talk about young women and birth control, although I guess that's not necessarily just for young women. So we can bring that into midlife. And how can the birth control pill, things like the birth control patch, something like that, affect women in midlife? We talk about how it's prescribed for hormonal imbalance issues, things like that. So when is the right time for the birth control pill, and when are times that people should maybe refrain from that and seek out an alternative?
Birth control pills are always right if you need them for birth control. I've always said that. I'm not against birth control pills. I think that they're empowering. They give women the control that they need. Unfortunately, in this society, women are responsible for family planning, and it's really what you got. So for birth control, I think it's great. When I don't think it's great is when doctors will defer to birth control to treat other problems, like, I'm 45 and I'm having irregular periods, or I have PCOS, or I have endometriosis, fibroids, whatever it is. The knee jerk with physicians, I call birth control that get out of my office prescription, because they don't know what to do. They don't want to do the deep dive. They don't want to look at hormones. They don't want to talk about surgical options. They don't want to talk about diet. exercise and all this stuff. So they just say, well, just put you on a birth control pill because it gets you out of the office. And when you have an OBGYN who's got 50 patients in a day, the OB patients who pay a lot more because it's a delivery take about 5 minutes. You get somebody in there with PCOS and they got to look at labs and they got to talk about diet and they got to talk about metformin and berberine and all the stuff. You're looking at 25 minutes and they don't have the time to do it. So I think one of my pinned posts on Instagram is where I'm walking into the hospital and I'm talking about a lady who I think is 52 and she came to see me for hormone replacement and the doctor had put her on birth control pills. Now, they're hormones, right? But it's kind of like why would you hit a nail with a sledgehammer versus a hammer? That's what the birth control pill is. It's like they hit your receptors so hard, it's about 7 to 8 times stronger than hormone replacement that you should be on. We know birth control pills have higher rates of breast cancer because they're synthetic and the way they hit that receptor is just different. And the doctor told her, oh, you can be on these forever. Well, pull your head out of your dark place where it's stuck and actually do hormone replacement. But it takes time, it takes knowledge, and it takes a desire to do it. And I just think most doctors just still don't care.
So are there risks for people who, like, say, this 52-year-old woman, if she had been on birth control since she was a teen, because at that point it was her only option? I mean, at some point, is there a mentality that you should almost take a break from the birth control pill? Like, does it lose efficacy? I mean, some people, I guess, would be on it for an extended amount of time or almost their entire life.
Well, fortunately, it doesn't lose efficacy. The problem is that we've gone the other way. So instead of, I mean, this was a big deal maybe 2 years ago or during COVID, where there were people out there like some of my colleagues that I won't name, who I don't care for, were saying that you don't need to have a period. Like you can take these birth control pills continuously. Like you don't take the week of the placebos and then you just start a new pack. Again, we're not treating the problem. The period is a normal physiologic process. Now, for some women, it may suck and we got to figure out why, but it's a normal process of life. And to shut that down, imagine if you told somebody, oh, you don't have to pee. Oh, okay. Well, I'll die. I mean, you're not going to die, so it's not like that. But at the same time, it's like, why would we shut down a normal physiologic process just because it's inconvenient or so we've gone the other direction. Is there a time limit? The longer that you're so here's the thing. What's interesting too, birth control pills aren't just all bad either. Women that are on birth control pills for at least 12 months total during their life have a 50% reduction in ovarian cancer rates. So that's good. There might be some lower rates of colon cancer and things like that. So it's not all bad, but there are increased risks of breast cancer and blood clots. And that's time sensitive, how long you've been on these products, the strengths. Now, initially, when birth control pills came out, they were a 50 microgram ethinyl estradiol dose. That went down to 35 to 30 to 20. And now they're down to 10. So they're 1/5 the strength that they were 10, 15, 50 years ago as we gotten better with them. So the risks are less, but for somebody to be on them long term, I mean, safety's there, but long term too, I would say if you are in your 40s or, why not just have your tubes tied, or why not have your partner get his tubes tied? Because I always say the best form of female birth control is vasectomy.
Right. Okay, well, that's interesting. There's also, who is it that wrote the book about, like, how the birth control pill alters the way that your brain, like, who you're attracted to?
Yeah, that's Sarah Hill.
Okay.
And actually, she's going to be on my podcast, hopefully in the summer.
Perfect. Well, it will be interesting to hear what she has to say about that. Another thing that we had talked about on the previous episode that we had some issues with was kind of the decline in medical education. And you had listened to a podcast, you did a podcast episode kind of touching on it. What do you think is it easier to become a doctor now? Is it harder? Are specialties going to get taken out by AI? Where do you think kind of the future of medicine is going to go?
Well, I don't think it's harder or easier right now. I think it's probably the same as it's ever been. You probably have 5,000 people at each school applying for 100 to 150 spots, which is good because you want to get the best of the best. Somehow I got in. I still don't quite understand that. But as I say this, my son is a fourth year medical student getting ready to match in anesthesia. And what you notice is the reason I had that episode is because of the way that we've changed the education system. There are people that might be in there that got in over other people. But that happens in college. That happens in a lot of places. You know, there's legacies, there's family members who strings, there's, racial inequities and things like that. And that does jade the pool a little bit. However, I do think you want a diverse community of physicians. You don't want everybody to look the same or talk the same or come from the same background. So I think it's important. As far as AI, I do think there's going to be some specialties that get smashed. Obviously, surgical specialties won't be affected really. Maybe not for another 150 years when they might actually have robots that can do stuff. But looking at things like radiology, reading x-rays, reading CAT scans, because right now, all they got to do is have a computer that can recognize pictures and then be programmed with AI from other doctors. And eventually, you know, people in small towns that have an x-ray in the middle of the night can get an immediate read. I think that's only coming. I think pathology, same thing. You're looking at a slide under a microscope and you're giving a diagnosis. Why a computer couldn't be programmed to do that immediately with 100% accuracy, I think is only going to be a matter of time. Another one would be infectious disease. You have a doctor now at the hospital who will consult. All they're going to need to do now is say, okay, the patient's got MRSA. Where do you live? Any antibiotic resistances, put it into the computer and it'll tell you what to treat them, how long to treat them, things to look for complications. The hands-on ones, anesthesia, surgery, OB, obviously delivering babies. But even eventually, there's a new product. I can't remember the name of it. It's in London right now. They're trialing it. It's a next gen or something like that, where you go into this box and it does all these biometric scans. And I believe you do blood tests and it puts them all together with these biometric readings that you got. And it gives you all kinds of longevity analyses. And so that stuff's coming. It's going to be just a matter of time. I do think that we're probably 100 years away, but as fast as things evolve right now, who knows? It's really fascinating. I don't know how it's going to affect medicine, but I also feel like, if you look back when I was a kid, everybody read books. Then we went to the Kindle and then now, but I think people are going back to books. I like to have that book in my hand when I read it. I want to read it in bed or in the tub, or it's easier to travel with an ebook, but I just like the books. Like whenever I go to an airport, I always go to the bookstore. I want to see what's new. I don't like having the thing with 100 books on it. And I think eventually it's going to come down to human touch and human factor. People are going to want that. So we'll probably go in one direction like we always do, and then we'll slide back the other way.
Right. Speaking of medical education, not necessarily just medical, but did you see that Harvard just announced that for families with an annual income of less than $200,000, they get free tuition?
At Harvard? Well, Harvard has a $50 billion endowment, so I don't think they're going to hurt too much. I think they could probably do free stuff for 100 years, and I think they'll still have plenty of money.
I saw that. I thought it was incredible.
It's all about endowments. They make more, I think I read, off of the interest from their endowments than it costs them to run the university every year.
That's crazy.
But that's what happens. You get a good college, rich people graduate, they go out and they make millions and millions of dollars, and then they will it all back to Harvard. And over years, they just invest it. And that's why the state schools, who get a lot of their money from the government, can't do that because they don't have these big endowments.
Do you think that something like that will last? I just don't see them continuing.
They could. But think about it. Harvard's got they got medical school, they got dental schools, they got, MBAs, they got all these things. Now they're online. What's fascinating what Harvard's doing is kind of genius. I have a friend who got, it wasn't even an MBA. It was just like a business, 6-month business course in management or something. And she's going around telling everybody she went to Harvard, but she just got this online certificate. And it's, so you could say I got my training at Harvard, but so they're kind of deluding themselves a little bit, I think, when they do stuff like that. But just think about the money they're generating from doing that. And, you know, you got all these people around now, you know, people, that's why I tell what people with expertise too. It's not like, you know, vet people when they say they're a guru or an expert. Where did you actually get your training? When this person says they went to Harvard, well, they went to Harvard online for 6 months, you know, from their kitchen in their robe. You know, that's not going, yeah. So I don't know. You just got to vet that stuff.
Well, I mean, I guess it could be good to open the door for some
Yeah.
people, but that would be interesting. We talked a lot about AI in the last one, and so you just touched on that. What do you think kind of the future, what is the big thing that we're looking at right now in women's health? We have this new breast scan. Why don't you tell us a little bit about that and how you've opened your eyes to thermography?
Yeah, well, I get complaints about mammograms all the time. And a lot of, maybe it's Austin, but a lot of women don't want to do mammograms, and that's all we got, current recommendations, and people asking why I can't do ultrasounds. I just did an episode on the podcast about 2 weeks ago comparing mammograms, thermography, and ultrasounds, and it's actually quite good because it shows you how sensitive they are. And realistically, numbers wise, thermography is actually better than the other two, but mammography is $1 billion industry, so it's really hard to change the requirements and the recommendations. Currently, every 1 to 2 years from the age of 40, unless you have a significant family history, then maybe ultrasounds or MRIs. But the thing is thermography just with a mammogram is actually quite good. And it even gives you more sensitivity and specificity, or true positives and true negatives, which is what you're looking for. The QT scan that's coming is a table that you lay down on face down, and there's a hole cut out where your breasts are. And there's like a little bowl underneath that, and it fills up with water. And then they do an ultrasound, I believe, through the water. And it's supposed to be, that's why I like when women are pregnant, they always tell you to show up with your bladder full, because you can see through water better. It's like a window. So the idea of putting the breasts in this bath of fluid makes the tissues easier to see. So for dense breasts and stuff like that. Currently, I think there's probably 4 or 5 places in the country that offer it. Jen Simmons is the doctor that's headlining that. She's a breast cancer surgeon. You can follow her on Instagram. She's going to put a place in Austin, I think, this year, but they're coming. They're not going to be covered by insurance initially. I do believe they are FDA registered, not FDA approved, but they're registered with the FDA currently. I might be wrong. But I think it'd be great if they can get better imaging, because anything to me that's going to make women feel safer to go get it done is a win.
Right, because we have patients I've seen just in the forefront that have come in and are like, I would rather have cancer than have to go through the mammogram. They'll just deal with it for whatever reason it is that, you know, their personal choice as to why they don't want to do it. There are some people that are just heavily against it. And so that kind of opens to, we have now got thermography in the clinic. What is some stuff that you've seen on those recent scans that we've done that you feel like it's not just going to be a breast tool? It can be stuff that we can use for other things. And I know there were some images of like how you can read hormone changes in the breast based on the temperature of the scan, things like that. So it sounds like it's going to be a really good addition.
It's anywhere in the body, really, because it's just heat. And so the thought process being inflammation brings more heat. The cancer has more blood supply, so it brings more heat. So and it's just one of those things. It's not a diagnostic tool in that sense, but it is more like, oh, maybe we should look at that a little bit more. And the reason that I brought it in was because I would have women that would bring them into me and they would say, what do I do with this? And I'm like, I don't know. And most of the centers that are owned by thermographers have no doctor affiliation. So you go in, you get the test, and then you kind of freak out because you don't know what to do with it. Kind of like a lot of these new MRI scans, these full body scans, they give you these reports. Low risk cancer or something, they'll call it. And it's like, well, what am I supposed to do with that? And you don't know. And then no doctor will look at it because they're like, I don't know what to do with that thing. So I thought, well, if I at least knew what thermography was, brought it in, and there was a hot spot on the left breast, I could do an exam. I could order an ultrasound. I could at least help these women follow up with the care. So it just seemed like kind of a natural progression. And, the other thing is over time, you change your belief structures. So I wasn't a big fan of thermography years ago because I didn't know much about it. And then over time, you start learning a little bit more. The technology gets better. And then it's like, okay, I can see where this would be valuable.
Right. Well, and I think something that patients don't realize is how limited providers are that are dealing with insurance. Like you mentioned that the QT scan most likely was not going to be covered by insurance, neither is thermography. But if you're going based on how insurance wants you to go for a breast exam, they require a mammogram before they will ever cover an ultrasound. So you're basically just going through a checkbox. Whereas maybe if you've had thermography already and you can show them that you have this existing test, they may allow you to start with an ultrasound or something like that. I mean, maybe it'll make some changes.
What's funny is, and talk about insurance, I pay $580 a month just for me. And I just decided I thought I'd get my eyes checked. Thought I needed readers or something. Turns out I have this really early cataract. So I was like, okay, well, let's just get it fixed. What the heck? And it was going to cost me like $9,000. Well, come to find out, I'm on an HMO, which means I basically have no insurance, even though I'm paying for it. So even though I know I have the cataract, I know I want it out, I have to find my PCP that I was assigned because I didn't pick anybody. Can't see me until May. The one that you looked for was like September. And then I finally found somebody. So I have to go into this person. I have to tell him that I've already done all this stuff just to get a referral to go back to the person that I wanted to go to get the surgery done. And it's like, so now I've been delayed like 5 months. I can't barely see on my right eye. I know I can see, but it's just blurry. But it's like, it's like, why can't I just go do what I want to do? I'm paying for this. And it's just a nightmare, which is one of the reasons I don't take it anymore.
Well, and ultimately it's costing, if you look at the bigger picture, it's costing the insurance company more money. They have to pay for you to now go see your PCP and then to go. It just doesn't really make any sense, but it's literally just some checkboxes.
Yeah. I remember when I was a kid, there was no insurance. You would just go in and pay the fee for service. I mean, there was none of this stuff. And then I don't know, I was probably in junior high when all the insurance stuff our insurance company stuff started. And now it's just turned into this horrifying thing. Yeah.
So,
yeah, we got a clinic. So, all right. Well, like I said, this segment, we'll probably keep it to around 30 minutes. If you have questions and you see this somewhere on social media, drop some questions, off the cuff, can be anything. Could be personal. I may choose not to answer it, but whatever you got, stuff you can't get to, other providers that are making claims, anything you want, just let me know and we'll take a look at it.
Absolutely.
Have a good one.
Bye-bye.
Thanks for listening. If you enjoyed this episode and you'd like to help support the podcast, please share it with others, post about it on social media, or leave a rating and review. To catch all the latest from me, you can follow me on Instagram at Shawn Tassone MD, or on Twitter at TassoneDoc, and on Facebook at America's Holistic Gynecologist. If you're really interested in your hormones and you want to do a deep dive, get my book, The Hormone Balance Bible, on Amazon or other major retailers. Thanks, and I'll see you next time.